You are getting 1 minute as well, and your timer starts now, and here is your question.
Yes, okay.
Just 10 seconds left, please. All right, so if you have read and understood, considering its surgical pathology station, please tell me, after reading the stem, what are the differential diagnoses you'll consider?
My differential diagnosis, I will consider squamous cell carcinoma and basal cell carcinoma.
Okay, can you tell me what are the differences between squamous cell carcinoma and basal cell carcinoma?
Uh, Differences is in their origin. Basal cell carcinoma from the basal layer of epidermis, and squamous cell from the superficial layer. So the superficial layer. Shape squamous cell carcinoma, as mentioned, is in the stem, barely shaped and have a central ulceration with rolled in edges. Basal cell carcinoma is has more ulceration and edges.
I think you're mixing, because this purely papule is
Up
in basal cell carcinoma.
basal
Have a
cell.
look. Can
Okay.
you please describe the image that you're looking at?
I'm looking at a superficial lesion, it's a superficial skin lesion,
Okay.
barely appearance with the telangiectasia.
Yes, and what is the size?
Uh, this is
Maybe.
the rolled.
Okay. How would you describe the size? And okay, can you see any ulcerations here?
No, I don't see any ulcerations.
Okay. And what about the
Barely
size? How
appearance.
big is the size?
Size,
Yes,
it's
in
not
that.
big. I think it's less than 1 cent.
Okay.
Okay.
But you have to tell transverse and vertical. So
Longitudinal.
yes.
Yes.
All right. Okay.
Okay.
This you have told me. Please tell me. Just suppose if it is basal cell carcinoma, and
Yes.
if you all right, how would you confirm your diagnosis?
Excision with excisional biopsy.
Okay. So after 2 weeks, the patient has come to you with the provisional report. What do you expect to see on in the report?
I expected to see signs of malignant transformation with
Okay.
uh,
Biopsy, you have taken excision biopsy. So
yes,
this excision biopsy will tell you that the sample was the depth of invasion with the sample that you have provided, how deep the lesion was. If the margins were excised enough, or the margins were left behind,
okay,
right? And
okay,
also if there was any ulceration on the lesion, or in the sample that you have excised, and if there was any palsidizations of the lesion. So this is the thing. Can you tell me how the basal cell carcinoma occurs or
it
takes
occurs
place?
second to skin irritation and irradiation and the sun exposure.
Yes,
It occurs in sun exposed areas. Uh,
yes, and
Due to this dysplasia of of cells of the basal layer of
Can
epidermis.
you please define the term dysplasia?
Dysplasia means abnormal growth pattern of cells that could be a pre-malignant growth.
All right, okay. How would you define the term pre-malignant or malignant?
Uh, I will define pre-malignant of malignant according to tissue architecture and the cell size and nuclear cytoplasm ratio. Any change will lead to a dysplasia. If there is any signs of if surround tissue invasion or distant metastasis could be it will confirm malignant transformation.
Okay, can you please tell me, after you've confirmed that, okay, this is basal cell carcinoma, what treatment would you suggest to this patient?
Uh,
There is one surgical excision, you've already
Surgical
told me.
excision, yes.
Right.
Okay.
When you're doing surgical excision, what would you consider? There'll be curettage and
I will consider the safety margin.
yes, how much? What would be the excision margin you'll keep in your mind? 4
Mm,
millimeter, 4 millimeter around the wound, okay?
okay.
Yes, and then you can also suggest cryotherapy, and number 2 could be radiotherapy or the tropical treatment, right?
Okay.
Right. Okay. What lifestyle changes would you suggest to the patient to adapt afterwards, after you've done the procedure?
Uh, Avoid the
Sun exposure,
sun
okay.
exposure
And
and
apply anything?
apply
Do you think,
sunscreen.
all
Okay.
right, sunscreen. Do you think basal cell carcinoma is gene related, or is there any gene involved in the formation or occurrence of basal cell carcinoma? If
I
you
will
don't know
evaluate after.
anything, then you can say, okay, you'll come back to this question later. All right, just suppose the same patient, you've excised the lesion, and after 2 weeks, the patient comes. The patient's wound is really inflamed and it's wet and it's weeping. What would you suspect?
I will suspect incomplete excision or recurrence.
Why not
Wound infection
infection?
could be
Yes.
wound infection at first.
All
It's
right. How would you manage that?
I will manage it first with uh, culture sensitivity. I will swap the lesion.
Okay. What is the
Then,
most common organism that is found in the lesions
aureus,
post-operatively?
Staph aureus.
Very good. Okay. All right. You've taken the swab and you've sent it for the lab.
Okay.
Result comes back and you learn that the wound has culture and sensitivity with the MRSA.
Okay.
What would be your next step? What would you do next
Um,
with methicillin resistant staphylococcus aureus?
yes, I will start treating the patient with the vancomycin.
All right. Before that, you'll do the incision and drainage of the wound.
Oh, okay.
Yes. And then you'll think of the oral
Or,
antibiotic. Okay. And anything else? What
uh,
precautions would you take?
uh, for his
Because,
contact
sorry,
uh, For the patient himself or for her, for him,
For the
his-
patient, for your own self, for the surrounding people, like your nursing staff, everyone who comes in contact with the patient? Okay.
screening form. Okay.
Screening, yes, exactly. You know the answer, but you have
Yes.
to, yes, you have to tell me so that I know that you know. Good. Bell has gone, and I would request to read through it. Thanks.
Okay. Can we shift the